With the number of active cases increasing, especially in the 80-plus age range in Halton Hills, Councillor Moya Johnson is criticizing the government's handling of the healthcare system. With 40 years' experience in healthcare as a nurse and planner herself, Johnson says one of her biggest concerns is long-term care in her community.
I think that was badly handled, and there's already outbreaks again in long-term care. I would hate to have a family member in there right now. I'd be very worried because I don't think they have the resources they need to provide the kind of care that people need during a pandemic, which is full-time staff that are trained and know how to care for people and how to protect themselves and also the clients or the residents from catching the virus, how to keep it out of the building. For instance, they've recently opened up visiting for long-term care so that people can go and visit their family, their mother or their father, but they need a negative test to be able to go. Well, now they can't get a test, so they can't go and visit because they need a new test. I believe it's every 2 weeks, a negative test. So there's the people in there that don't see their family, wonder perhaps if they have some memory issues. Where's my daughter? She hasn't come to see me and she can't go. And FaceTime, for really older people isn't it's good for you and I to meet this way, but not necessarily for people who don't understand why someone's not there. So long-term care is a huge issue.
Although there has been less hospitalizations so far, Johnson says it doesn't mean people should be dismissive of this second wave, as the healthcare system is still dealing with the ripple effects from the first one.
Hospital capacity, there was a lot of canceled surgeries, cancer treatment, prenatal care, things that go on in the usual healthcare system that were totally stopped during the pandemic, thinking that we need the hospital capacity for COVID patients. Now, luckily, the healthcare system survived that, but already, if you listen to the physicians, the infectious specialists are saying, we've got to do something. We can't just say we've got hospital capacity because we can't shut down again. The waiting lists are huge for people who need other care. And if we get back into that situation, it's not good for people who aren't getting diagnosed with cancer, aren't getting mammograms that are delayed 6 months, and that might be the difference between survival and not survival. So the healthcare system is fragile, and we can't just say, well, we've got lots of capacity now, so it doesn't matter if people get sick. It really matters, and it matters for every person because people are still dying.